And may I just say that surnames are overrated, so don't worry about it. Yeah, so my name is Nils Fietje. I'm a technical officer at WHO and the co-founder and co-director of the Jamila Health Lab, as Vicky was just mentioning. And I wanted to start off by saying thank you very much for inviting me. I think unlike many of you in this room, I'm definitely not an expert in arts and health, but I have, over the last few years, become very interested in this space, and together with Chris, my colleague at WHO headquarters, and now with Nisha and Stephen as part of the Jamila Arts and Health Lab, I'm trying to forge a path for arts and health within the WHO. Now, I'm going to give a bit of an overview of some of the things that we're doing. As is one for these kinds of presentations, I hope it will come across as being meaningful, but I think I do have to caveat this activity by also saying it is still a little bit of a satellite orbiting around the big planet that is WHO. So while we have been very active, and I believe going forward we will continue to be even more active, it is certainly far from being mainstream at WHO yet. But nevertheless, I think we've made very good inroads. So, where does one start? I think a lot of people start these presentations by kind of pointing out that art and health have intersected probably as long, or almost as long as our species has existed. They say that long before humans knew about penicillin or genetics, they created music and art, and they created music and art and pointed out our need to express our hopes and fears, to create meaning from our surroundings and to share this through artistic creation. Now, I'm not going to go that far anymore. I recently came across a critique of that argument, so I won't promote it too much. But I will say that every time I meet somebody, especially somebody who doesn't know about arts and health, they immediately intuitively understand the connection between arts and health, and especially also arts and well-being. They are rarely surprised about the idea that art can improve health or that it can contribute to our well-being. And that's why I think this quote that we have here from the famous French painter and sculptor Georges Braque is quite illuminating, because it creates a sense of the relationship between art and health in a way that really only an artist can. Art is a wound turned into light, he says. Now, again, it's probably safe to say that the study of arts and health, like the study of many fields, was not born on a specific day, but that it's being made over the course of time. And while the exact history of the field hasn't yet been written, maybe it's possible to provide a few broad brushstrokes. We could look towards the creative art therapies, for instance, which maybe came into existence around the 1930s. We could look to the 1970s as perhaps the beginning of the arts in health movement. And then perhaps we could look at the 1990s as a point when arts in public health became more prominent and possibly even came into existence. Now, on a policy level, particularly in the European context, I think there are perhaps two cornerstones that I'm going to allude to, and I say this specifically in the European context. One were the Windsor Conferences of 1998 and 1999, as well as the ensuing declaration, which sought to elevate the arts, health, and well-being into a pivotal role across the spectrum of healthcare. And next, and I hope this isn't too self-congratulatory, I think the 2019 report, also from the WHO, which I might say I contributed to, but was largely the work of Daisy and Saoirse, provided a kind of moment in the space of global public health where at least some attention was focused around arts and health. Now, I think it's also worth acknowledging that the report has received a lot of criticism as well. There's a lot to be done. It wasn't a systematic review, it was a scoping review that considered all study designs and all methodologies. It didn't try to say where is the evidence best, or it didn't try to rate the evidence, but it did cover more than 3,000 publications that illustrate the positive effects that arts interventions can have on a range of health challenges across the life course and throughout the continuum of care. Now, specifically, it focuses on health promotion, illness prevention, and the management and treatment of disease. So those are the kind of 4 rubrics into which the report categorizes the studies which it covers. And it also covers performing arts, visual arts, including design and craft, literature, culture, online, digital, and electronic arts. Now, even though we tried to make it as broad and as encompassing as we could, due to the limit of a lifetime, I guess, due to the limit of the limits that we had imposed on ourselves, there are still many things to be said and many things that have been left out. And hopefully future reports like this will cover those shortcomings. But in essence, I think it gave us a very strong starting point from which to argue that there is an increasing amount of evidence to support the implementation of arts interventions in some cases. And this could include, for instance, very simple things, like, for instance, using recorded music in post-operative environments to help promote post-operative recovery, for which there is very good clinical evidence and which presents a very low risk, and which also presents a very low financial commitment. Now, the report comes out with a few recommendations. It is, after all, a report aimed at policymakers. One of those recommendations is relatively straightforward: to encourage policymakers to think about implementing or using arts and health interventions for which there is good evidence. And I just gave an example of one of them, but there are others in the report as well. The other is to promote more sharing of case examples and activities between countries. I think one of the things that we've certainly noticed at WHO is while there are pockets of activity to greater or lesser extent throughout the European region, and the UK obviously is one space where there's a lot of activity, those bits of activity or those emphases are rarely linked together. And here's really a space where WHO is trying to make a difference as well, and I'll come on to the Juvenile Arts and Health Lab in a moment. And the other important recommendation that the report makes is to emphasize the need not only for the health sector, but also for the arts sector to recognize its potential in the health space, and to encourage cultural facilities, for instance, like museums or other spaces, to consider whether there might be a space within their strategy that could address health challenges and health issues. So I'm going to go through a few slides that illustrate some of the work that we've been doing since the report. And these have been, in many cases, these have been opportunities that aren't necessarily built on a kind of strategic foundation. They've been in response to questions that member states have posed us. One of those was in relation to the refugee crisis in Europe, triggered, of course, by the war well, not just triggered by, but most recently triggered by the war in Ukraine. And so we published a policy brief, a very short 5 or 6 page document that seeks to show how how arts and health can support in the mental health and psychosocial response towards forcibly displaced people. Now, as it says here, 84 million people are estimated to have been forcibly displaced in 2021. The statistics for this are always quite a bit behind. And at least in the first half of 2022, it was believed that 17.5 million Ukrainians had been forced to leave their homes as a result of the war in Ukraine. Now, the policy brief is essentially constructed as a rapid review of evidence that draws out some themes around ways in which art activities can promote or prompt psychological, behavioral, and social processes that are linked to improved health and well-being and the reduction of trauma symptoms. And I think a critical point that the policy brief makes is that the engagement in arts activities can lead to a greater sense of belonging and solidarity, not just within the communities of forcibly displaced people, but also within the host communities. So not to single out this activity as just being of value or benefit to forcibly displaced people, but having a wider context as well, a kind of win-win, if you want. I should also say, actually, and maybe I'll go back for a second to the previous slides. You may have seen that each of these slides has a QR code on the bottom, or at the bottom of the slides. These are the QR codes for the corresponding reports or publications, online publications. So if you want to take a quick picture, it should take you directly to those reports. This being the 2019 scoping review, and this the policy brief on forcibly displaced people. Another product that we produced was, again, a policy brief that looks at the need, or that looks at the intersection between arts, health, and well-being on a policy level. The report, the policy brief promotes the public awareness of the benefits of health, of engaging in the arts, and poses the question to policymakers who themselves often operate in their own silos, in social, healthcare, arts, culture silos, and aren't necessarily talking to each other. Sets them the challenge to say, here's a space where intersectoral action, where arts, where health in all policies actually exists in a very practical way, and encourages those public health and cultural policymakers to really figure out how they can talk together. Some of the core arguments that the policy brief makes is to remove the barriers for accessing the arts, including among older adults, and people with mental ill health, people of lower social economic status, members of ethnic and other minorities, people with health conditions or disabilities, and people living in geographically isolated areas. It also argues to facilitate the development of partnerships and partner working between health, social care, and arts sectors, and critically, to develop training, resources, and guidelines that will support the collaboration between the arts and health sectors. And this final point, as I say, incorporating arts and health evidence in policy documents is also something that we're really pushing for colleagues in various member states to consider. And I'll come on to an example of where this has happened at the European Commission level. Now, one of the more practical projects that we've been involved in recently is a project called Music and Motherhood. All of the things I've talked about until now have been relatively well oriented at the level of policymakers in terms of documents or policy recommendations, policy briefs, the scoping review that I mentioned. But this is really something where we're practically investigating how implementing an arts and health intervention actually works in different cross-cultural settings. So the intervention is called Music and Motherhood. It was, like so many interventions, originally designed in the UK in a partnership at the Performance Science Centre, a collaboration between Imperial College and the Royal College of Music. And it takes, it's essentially an intervention that's aimed at mothers who are experiencing postpartum depression. It's organized around specifically designed singing groups that bring together up to between 10 and 12 mothers over the course of 10 weeks. And we were very, well, I should say, it's one of those interventions that has very good clinical evidence behind it that seems to show that mothers who participate in a music and motherhood intervention, particularly if they have severe to moderate symptoms, that they can achieve clinically meaningful reduction in their symptoms. So it's an intervention that's based on good clinical evidence. And we were very interested to see whether or not an arts and health intervention that is designed in one specific cultural context can translate effectively into other cultural contexts. And that includes questions around language, but not only. Obviously also lots of other subtle nuances around cultural translation are important here. So we worked together with Denmark, Romania, and Italy to create a multi-site implementation study. And in Romania, we in fact implemented the intervention in 2 languages, so in Hungarian and Romanian, because there's a Hungarian minority population in the city where we ran the study. So we had a total of 4 languages, 5 cities, and over 70 participants over the course of 1 year. Now, we're only beginning to sift through the data, both qualitative and quantitative, but broadly speaking, it seems that the effectiveness of the intervention was maintained. And I think we've learned a lot from how we implemented the intervention in these different cultural contexts. And one of the things we now want to do is to take this as a case example, the Music and Motherhood Implementation Study, and to draw out some critical learnings that we think are important whenever it comes to translating any scalable intervention into other cultural contexts. So this is a report that we're hoping to publish in October, and something that I think member states have been asking us for a while. I would say the trajectory has been, we made the case for intersectoral action, we made the case for, or at least started making the case for the evidence in this field, and now member states are coming to us and saying, well, okay, so we want to try this out, we want to give it a try. How do we actually do it? Can you give us some guidance about how to implement an arts and health intervention in our country? And I think that's where we're hoping to go. Now, the other product that colleagues of ours from the Western Pacific region published late last year is a toolkit on how to implement social prescribing. Again, aimed very much at policymakers who are interested in the space. I'm assuming everybody here knows that social prescribing is a means of connecting patients to a range of non-clinical services in the community to improve their health and well-being. But the point of including it in this presentation is to kind of say one of the things that we're missing in a lot of health systems is the connecting link. So while we can run individual arts and health implementations or interventions or activities, it is still pretty much impossible in most countries, at least in the European context, for somebody or a patient to come to their family doctor and to be prescribed or rather to be given the opportunity to actually participate in an arts and health intervention. So those logistics, that kind of connecting fiber still needs to be developed in most of the countries in the European region, and that's why this toolkit is really something that we're hoping to use to have those conversations. Now, having said that, obviously there are some countries, the UK being one of them. Sweden is also piloting in several parts of its region with, it's also piloting social prescribing mechanisms. Denmark, one of the reasons why we worked with Denmark was because there was the beginnings of a social prescribing network, at least in one part of Denmark. And Austria at a national level is also becoming very interested in this space. It's just started a working group to begin planning social prescribing pilot projects. So I've telegraphed this a little bit. As I was saying, one of the recommendations in our report was to provide a place, really a global place, where arts and health activities can be promoted, can be supported, and can also be evaluated, such that we have a space that member states can come to if they're interested in arts and health, to see what the latest state of evidence is, to to see what countries have done in this space and to learn about what types of arts and health activities work. And so late last year, we received some funding from Community Jamil to work together with NYU and also with an organization called Culture Runners, so NYU Steinhardt and Culture Runners, to create the space, the Jamil Arts and Health Lab, which is now collaborating with WHO. Its focus is on overlooked and underserved communities. So I think a lot of the times when we're talking about arts and health, we're talking about arts and health in the kind of Western context, and not often do we look at the lower middle income countries. And so this is really a space where we want to have more conversations, bring more conversations up in order to redress that balance a little bit. And there are many colleagues, many organizations in the so-called global south that work in this space but don't perhaps consider themselves to be arts and health practitioners or arts and health researchers. So we're hoping to bring that conversation or include them in that conversation and to amplify their research or their work as much as we're promoting work in global health. So maybe just in summary then, the Jamil Arts and Health Lab, its main purpose is to amplify research, coordinate evaluations. I think a critical part of what we want to be doing is rigorously evaluating, rigorously and meaningfully in the context of arts and health, examining and evaluating arts and health interventions, and increasing the policy uptake of those interventions and of those activities. And that's really where the collaboration with WHO comes into effect. That's where we're hoping to have more conversations, more convenings, promote more understanding of the arts and health space within governments across the European region and the globe. So maybe before, I think the good news is that on a political level, there are more and more examples, but particularly over the last 5 years, or I'd say actually last 3 years, there's an increasing amount of activity in this space, both at the city, national, and EU level. Brussels just recently introduced a Museums on Prescription initiative, just a small example. Greece, late last year, announced a cultural prescribing initiative as part of their COVID-19 regeneration fund. And at the EU level, and this is what I was alluding to previously, at the EU level, the European Commission recently published a communication around a new comprehensive mental health plan that they're hoping to be adopted into the EU. And within that plan, there's for the first time in, I would say, EU public health policy making, a recognition that cultural activity, that arts activity plays an important role in the health and the mental health and well-being of the European citizens. So I think there's a number of really great indications that we're making excellent progress in implementing arts and health in European and also more and more global policy. So maybe this is, I'll make this my final slide then. Future opportunities. I think there's a need for the creation of a dedicated platform for policymakers to convene around arts and health, and I think that's where the Jamil Arts and Health Lab is going to play at least a part. There's a need to link arts and health to health systems, whether this is through social prescribing or other forms like it. I know there's a big and important conversation happening around just the term social prescribing, how useful it may or may not be. There's an important need to develop targeted arts and health training, really across healthcare professions, arts practitioners, medical students, a wide range of audiences. And I think there's also a need to implement and evaluate arts and health interventions at an international setting. And I've talked a little bit about the reasons for that. But I think the thing that I want to leave everyone with here is my sense, at least, that while gathering evidence and doing evaluations is still critically important to growth of this field, my sense is that the needle is moving. The needle is moving away from just generating more evidence towards actually understanding how to implement them and how to make arts and health work. And I'm pretty convinced that maybe in the next 10 years or in the next 20 years, but sometime, certainly within my lifetime, arts and health will be a firm component of health systems across the world. Thank you. Oh, and I wanted to say one last thing. I wanted to say thank you, of course, for you being patiently listening to me, but I also wanted to say thank you very much to you, Vicky, for all the work that you've been doing as a leading person within this space, within this field. The work that you've been doing to help and support WHO and the Jameel Arts and Health Lab has been much appreciated, and I hope you, as well as everybody in this room, all your colleagues, will continue to really blaze a trail in this space for this work. So thank you very much for listening.
So if we take a wonderful conclusion towards that.
About you?
Should we take a few questions? We have people in person here. We have a wonderful online presence as well. Do we have questions from you? Yeah?
So, as someone who's been through the mental health system in the UK and been oppressed by the system, how do you see the WHO's position in working with equality, diversity, and providing a better service? Because it's all very well the research being done, but on the floor, I'd love you to go into some wards and see what goes on, really.
Yeah. So I think that's a really difficult and profound question. It's probably not something that I can answer meaningfully here, standing in front of you in this podium in a couple of minutes. What I would say, though, is that those concerns are very central to the work that we're doing within the Jameel Arts and Health Lab and within the arts and health space. So I don't think I have a simple answer for you, but I think the focus is there and the attention is there. And certainly, I mean, if I can be a little bit banal, it's just a tiny aspect of of this big problem that you're describing. But within our kind of sphere of influence in relation to the music and motherhood protocol, for instance, we were very focused on involving patients and involving the public in co-creating the localized versions of the protocol. So, as I say, it's not a simple. There's no simple answer to this, but I would reiterate that our focus is very much on the problems that you described, so that we're not exacerbating them or that we're not recreating them.
Hi. Oh.
Do we have any questions from the online people at home, Sabrina? Not yet, but we have a lot of hands up here. So, Stephanie?
Hi. Thank you for your presentation. My question's a bit maybe more political, and it's about considering that Brexit and that the UK is not a part of the EU. In what way does the WHO have influence or impact on these policies and implementing them?
In the UK, you mean?
Yeah.
So Brexit, within the WHO system, Brexit is one of the few places, I guess, where it doesn't matter. So the WHO European region is far beyond geographical Europe. It includes Central Asia, it includes Israel, it includes certainly the UK, and 53 member states in total. And then it's just a way for WHO to organize member states to have a more focused dialogue with certain regions. So Brexit hasn't changed anything in the way that we interact with the UK government. But I would also say that the UK government, along with, I guess, several, or perhaps even most Western European governments, don't feel like they necessarily need WHO's help, if you see what I mean. So we don't tend to work as closely with Western governments per se. Our focus tends to be more within Eastern, geographical Europe, and then also Commonwealth of Independent States, Central Asia, and so forth.
We have one more question here from Carl. How we do with time? 4 minutes, so we can take 2 more questions, right?
Okay, I'll make it quick. Hello, thank you. Really interesting presentation. My name's Carol Rogers. I work at National Museums Liverpool. My question's around the research focus that could perhaps delve a bit deeper into the economic value that the arts and health sector brings to acute care or primary care provision. And I ask this question because I've been running a programme in Liverpool and internationally for 10 years now. It's called House of Memories. It's a dementia awareness programme, positioning museums in the space of dementia. The big challenge I have is financing the programme and sustaining the work. I think there'll be a lot of us in the room today that have fantastic projects, but the challenge is, how do we as a sector within arts, creativity, museums, music, how do we keep it going, and where is the opportunity for us within the WHO research model?
I think that's a great question. And when I said the needle is moving, and I kind of said we obviously still need evidence, I think one of the things that we really still need evidence in is the kind of health economics, and health impact, the cost effectiveness of arts and health interventions. I think we tried to produce a rapid review on health economics of arts and health, or at least in some specific scenarios, and there wasn't a lot out there, at least not of the standard that we would need in order to include it in a publication. So that really is still a big call to the research community to try and include health economic studies or components within the research that they're doing. And I know that this is super difficult because we had the same issue with our Music in Motherhood project. We didn't have a huge amount of money to do it, and we had to kind of figure out where our emphasis was going to be, and just making it happen basically took up the budget of the project. We did explore trying to include a health effectiveness, health economic component to it, but in the end we couldn't afford it, as it were. So I'm very well aware of the reality challenges in that space, but I think it is, it is an argument that still needs to be proven.
Thanks for the presentation. Fantastic points raised there as well. It's a really quick question that I'm interested in, whether you've got any examples of where the evaluation methodology from the cultural sector is married and speaks to the evaluation and research methodology from the health sector, because certainly one of the challenges we faced in Blackpool and Lancashire is finding a way of aligning those two worlds so that the value of the cultural sector and the evidence gathered is understood with the same weight. So anything that you've got that could speak to that? Thank you.
I don't have anything, as in I'm very, very aware of the challenge. I don't have, unfortunately, like an evaluation package that I could recommend. Although it is something that we want to, as part of the Jameel Arts and Health Lab and with collaborators across the globe, it's something that we want to hopefully be producing over the next couple of years. Again, I don't think it will be a one-size-fits-all, here's the thing and it solves all our problems, but hopefully it will bring together some ideas around that space. One thing I would say, though, is that those conversations are happening also in the biomedical sphere. It's not just that arts and health colleagues feel that, the kind of evidence-based, the focus on evidence-based and evidence hierarchies is insufficient. It's not, that feeling is also beginning to permeate I think, into in the wider public health space. I don't know if you're familiar, for instance, most recently there was a Cochrane collaboration review on hand washing and mask wearing that came to the conclusion that there wasn't enough evidence to support either, and that more research was needed. And there was I think there's been a lot of conversations around these topics, but I think it's becoming more and more an issue also within the public health space to say, well, okay, what is evidence that we can actually use? Timely evidence, good enough evidence. How does qualitative evidence fit in? I think these conversations are permeating the whole public health space.
Can I add something to that? It might be a good transition to the next topic we have, because I don't know whether that's on. Is it on? Yeah, is it on now? Yes. So it makes a good transition to the next topic, because one of the things we are currently working on and is thinking of how to work with the health sector and cultural organizations to agree on a framework, evaluation framework that will also include the issues around evidence. What is the evidence that will be accepted and agreed across sectors? So we are getting there, at least at a local level, and we might want to thank Nils now for his brilliant presentation. Thank you, Nils. You really framed the work beautifully. And I'm going to move us. I'm going to give Gabi her microphone because I stole it from her, and it clearly belongs to Gabi. So